The Blue Zones Project Blueprint. In the blueprint document, Blue Zones Initiative has identified, in essence, what it calls 13 pillars for community health living that project believes are important, that one, involve community work sites, grocery stores, restaurants, schools, faith-based organization, as well as a commitment to public awareness with respect to health. Each pillar has an associated target. These are target goals. There is a food policy and a tobacco policy recommended. District already has this. There's also a safe route walking to school program, which the district is implementing. And there is a goal of having 12 Blue Zone schools over a 3-year period. This, of course, is dependent upon the discussion this evening. But as I read it, this proceeds at 4 identified schools per year times 3. And ultimately, the goal, as I understand it, is over an 8-year period, 50% of schools would be involved in this Blue Zone project. There is a focus as well in this document on encouraging broad community participation, including community-wide measures, reduction in the BMI, decrease in childhood obesity, increasing physical activity, increasing vegetable consumption, and the reduction of health care claims, and a concern with a decrease in diabetes, health disease, and cancer rate. With respect to the health care claims, that's an initiative that we already have underway within our own health care program. It is also concerned that there be established a Southwest Florida Summit to increase health awareness, education programs, and encourage interagency cooperation. The next key document involves becoming a Blue Zone community. As I understand it and reading it, it's based upon a 6-year data research study and methodology related to how Americans perceive well-being. It includes topic areas such as physical and emotional health, healthy eating, healthy behaviors, proper health care, and so on, as well as the concern for a community-wide initiative to bring together as many sectors of the community to participate in these objectives. And so what does it do? It develops what it calls 4 key environments. There should be social networking. Another environment, of course, is the community environment. There's also a concern with habitat, such as workplace, schools, restaurants, grocery stores, and then there is the development of the inner self as an environment to help think purposefully and enhance well-being. The Blue Zone Pledge document is to create an environment to instill healthy life choices. That's its central concept. And then becoming a Blue Zone school is the one that we should spend a few moments on concerning the categories that Ms. Donalds referenced last time. These involve 21 categories of trying to implement existing policy plans, and where none exist, to check off areas to do so to achieve certain points. There are 4 required categories of the 21, 3 prohibited areas, and 1 enforced, which I interpret as equivalent to required. So if we just say that that's the case, then you would have 5 required categories and 3 prohibited areas. I know the board has had a look at some of this, so I'd like to just review some of the areas and how I understand it, and perhaps if it's not complete, then Dr. Patton's staff can address that issue. The issue that was talked about several times in public comments was the establishment of a health wellness council that meets regularly at the school. Actually, we do that, and it's in the form of health and wellness committees that operate within each school. So this is not like a council, a political council that's imposed. We already have it established from within. The enforcement of a tobacco-free campus, our policy covers that. Discontinue using food for fundraisers. Well, we don't do that. So it would mean then that since we do allow for food for fundraisers pursuant to 5830, that would be an area where a school would not be able to opt in to get points. So as I understand these categories, you can go through the 21, for example, and make a decision as to which areas you think you can comply with, and that should be in alignment not with their policies but with our policies to make sure that you can carry them out and to show that they are policy-based. So, for example, the top, it says policy, implement, and enforce at least one policy in this section. So we then, through a point system, whether it be elementary, middle, or high school, would be able to say, for example, can't work with you on number 3 because we already have 5830, which allows that sort of thing. Prohibiting the sale, for example, and consumption of soda and other sugar-sweetened beverages on campus. We do that at the elementary and middle levels. My understanding it's not occurring thus as yet in the high school level. So therefore, let's say if you have a high school program, they themselves probably would say, I guess I won't look to that area to try to gain points. And understand, as I read this, if it turns out that you don't get enough points, then you don't get qualified as a blue zone school. I mean, you know, it's like a football game. You lose. So not enough points earned, and you have decided you're not going to play by the rules of the game, and you're going to pick and choose things to your advantage, you also run the risk of not gaining enough points. Similarly, if we look at the area on number 8, prohibit unhealthy food and beverages, advertisement, and so on. This is a mixed area for the district. We try to prohibit unhealthy food choices. We're not really clear on the issue of advertisement, so whether somebody could opt into that one would have to be an area in which there'd have to be an administrative procedure, for example, developed relative to advertising, or the board itself would have to approach it from a policy level to determine the issue of advertising as it pertains to food on school grounds. Requirement that students are physically active during the majority of time in physical education class, that's in place. Require 150 per week, minutes per week for physical activity, that's in place, especially with respect to elementary and middle schools. Require students to pay for unhealthy food in the cafeteria. We really don't address that issue. We don't require them to do that anyway, so they could indicate that they are in line with that. Another one was, for example, prohibit consumption of food beverages other than water in the classroom. We already have the School Healthy Choice and Healthy Snacks program. And then, as I recall, there was one related to issues of off-site, after-hours programs were to try to make those environments healthy environments. We don't force people into that. I mean, people serve things at football games and so on. It's after school. So that would be an area, for example, that schools probably would say can't address that area as part of the point system. So overall, and then of course there is the programs, there are multiple programs that are provided that, such as the Implement a Farm to School program. We have programs that our elementary schools are bringing in fresh produce, things of that sort. The garden program, my understanding and speaking with staff is that there are 19 schools in the district that are involved in developing gardens and so on. So these areas, as I read them, don't impose anything on anyone. It's a question of choice as to which categories you want to decide to rely upon if you're going to participate. And at the end of the day, if you're dealing with 4 schools a year, that would suggest to me that 46 others are going to go about their business anyway. And the same would apply as it develops over time. The issue is those 4 schools, whether they will be successful at earning the points or not, and probably at the end of a year or whatever, given the program and the requirement under policy that a principal would have to discuss and bring findings back to the district, that we would know pretty well at the end of a year whether those schools are finding it a good idea to be involved in these programs. So I don't see the imposition of an outside agency telling the district what to do, and our policies are really quite rich in their directions to carry out most of these anyway. And I think if there ever was an issue, as I mentioned to you, of a disagreement between a proposition within Blue Zone and a district policy, our district policy wins. So that, for example, the request or proposition discontinue using food for fundraisers not going to work because we allow it within 5830. So that's my general comments in the application of Blue Zone concepts to district policy and the structure of district policy.
I appreciate that on behalf of the board, Mr. Fishbane.
Thank you.
Do I have a motion and a second, and then we can discuss?
Make the motion that we approve the district's participation in the Blue Zones project as demonstrated by the superintendent signing the attached letter of understanding. Would you like me to read the letter?
Yes, ma'am.
Okay, the letter says the Collier County School District approves its participation in the Blue Zones project with the understanding that such participation is non-binding and voluntary in nature and part of a cooperative venture with other community businesses and agencies to enhance wellness in Collier County. The Blue Zones project does not intend in any way to create, interfere with, or amend any school board policy.
Do I have a second?
Second.
I have a second from Ms.